From the different population or patient groups in patient and provider-initiated programs, the model collects the number diagnosed and initiated on treatment for drug-sensitive or drug-resistant TB disease. Regimen volumes recommended for defined patient groups estimated in this section are based on a resistance profile and the volume of drug sensitivity testing. In terms of the regimen allocated, no further distinction is made with respect to the patient or provider-initiated programs in which patients are diagnosed. Instead, a resistance profile and a drug susceptibility testing structure is applied to the total number to receive treatment to estimate the numbers receiving different regimens. Those receiving drug susceptibility testing receive appropriate treatment, and those who don't receive drug susceptibility testing may receive inappropriate treatment. For example, patients with drug-resistant TB who don't receive appropriate drug susceptibility testing, or DST, may receive first-line treatment. The resistance profile is identical in structure presented in two editors, one for new and one for re-registered patients, noting that we see higher degrees of resistance in re-registered cases. The editor has two conceptual parts, one describing an average resistance profile, which the user can partly edit, and one specifying additional costing elements related to treatment and patient management, which the user can and generally must edit due to the approximate nature of the default values provided for these additional inputs. The following treatment profile is used to represent WHO treatment guidelines and to ensure provision of appropriate treatment, following provision of the relevant drug susceptibility testing. The resistance profile specifies the proportion of patients that are rifampicin sensitive, including isoniazid sensitive or resistant, rifampicin resistant, including fluoroquinolone sensitive or resistant pre-XDR, and XDR, pre-XDR and resistant to at least one of bedaquiline, linezolid, levofloxacin, moxifloxacin. Assignment of regimens to each branch requires the relevant drug susceptibility testing to be conducted. Resistance testing on the next tab will be discussed shortly. The model design assumes that patients who receive no DST receive default treatment for rifampicin and isoniazid-sensitive patients. Similarly, rifampicin-resistant patients receiving no DST for fluoroquinolone resistance receive the same regimen as those with confirmed fluoroquinolone sensitivity. Rifampicin-resistant estimates come from the WHO TB resistance burden database. Assumptions which the user can edit are made regarding populations with isoniazid resistance and fluoroquinolone resistance. The default proportion with fluoroquinolone resistance featured in the tool can be estimated from the WHO's database for some countries, but being part of routine surveillance, it is generally regarded as an underestimate of fluoroquinolone resistance, especially in countries where fluoroquinolone is widely prescribed. The model therefore uses 20% from a meta-analysis for fluoroquinolone resistance proportions instead. The user inputs the proportion of cases with XDR defined as pre-XDR and resistant to at least one of bedaquiline, linezolid, levofloxacin, moxifloxacin. Several other inputs among adults and children are needed for treatment-related costing, including the proportion of adults and children without severe disease or with TB meningitis. This data is not available from the WHO database and must be estimated by a country user. The proportion MDR or XDR TB patients requiring lung resection surgery and patients whose curative treatment options have been completely exhausted. These estimates of a typical patient profile are used to control the proportion of patients requiring lung surgery or palliative care. Default values, which are highly approximate, offered to the user are the same for adults and children, but the user can change this if they have country-specific information. Next, the user must state the coverage for different types of TB resistance testing, with the distinction made regarding pulmonary and extrapulmonary status required mostly for costing. Drug sensitivity testing coverage is specified for rifampicin resistance testing, isoniazid resistance testing among rifampicin-sensitive patients, fluoroquinolone resistance testing among rifampicin-resistant patients, and bedaquiline, linezolid, levofloxacin, moxifloxacin, resistance testing among fluoroquinolone-resistant patients. We don't have default data on the coverage of different forms of resistance testing. However, the model requires these coverage elements to calculate eligibility for different regimens. In the model, eligibility is conditional on appropriate drug susceptibility testing. Otherwise, first-line treatment applies. In the number to be tested for resistance, the target populations related to resistance tests are presented, following application of the configured resistance profile. The table states, for pulmonary and extrapulmonary TB, the number of patients to be tested for rifampicin or simultaneous rifampicin and isoniazid resistance testing among patients with unknown rifampicin and isoniazid resistance, isoniazid resistance testing among rifampicin-sensitive patients, and fluoroquinolone resistance testing among bacteriologically confirmed rifampicin-resistant patients. Among fluoroquinolone-resistant patients, for both pulmonary and extrapulmonary TB, the table states the number to be tested for resistance to bedaquiline, linezolid, levofloxacin, moxifloxacin, pre-XDR, or XDR. These numbers are calculated and cannot be edited. To change these numbers, the user can edit the resistance profile on the first tab. Target populations related to resistance tests are presented in the Number Tested for Resistance tab, following application of drug susceptibility testing coverage inputs to the number to results of the tab, Number to be tested for resistance. These target populations provide inputs for costing drug susceptibility testing services. The table states, for pulmonary and extrapulmonary TB, the number of drug sensitivity tests performed, the number of rifampicin or simultaneous rifampicin and isoniazid resistance tests among patients with unknown rifampicin and isoniazid resistance, the number of isoniazid resistance tests among rifampicin-sensitive patients, and the number of fluoroquinolone resistance tests among bacteriologically confirmed rifampicin-resistant patients. Among fluoroquinolone-resistant patients, for both pulmonary and extrapulmonary TB patients, the table states the number tested for resistance to bedaquiline, linezolid, levofloxacin, moxifloxacin, pre-XDR or XDR. These numbers are calculated and cannot be edited. To change these numbers, the user can edit either the resistance profile on the first tab or edit the coverage of resistance testing on the second tab. Target populations related to confirmed TB resistance of different types are presented, following the application of the resistance profiles and drug susceptibility testing coverage. These target populations provide inputs for regimen allocation, specifically regimens for the treatment of drug-susceptible TB, both rifampicin and isoniazid sensitive, the treatment of severe TB, including TB meningitis and pericarditis, the treatment of rifampicin-sensitive and isoniazid-resistant TB, the treatment of rifampicin-resistant and fluoroquinolone-sensitive TB, the treatment for rifampicin-resistant and fluoroquinolone-resistant TB, or pre-XDR TB, and the treatment of extensively drug-resistant TB. These numbers are calculated and cannot be edited. To change these numbers, the user can edit either the resistance profile on the first tab or edit the coverage of resistance testing on the second tab. The use of these target populations can be viewed in costing configurations. Please see the costing video.